All right, I think we're live here. Good morning. Thanks for showing up this morning. Good to see such good turnout to share some real exciting news today in our community. Just kind of getting right to the point, right out of the gate. We're going to be announcing today that the City of Sioux Falls and the Parks and Recreation Department here in the city intend to purchase the Sanford Wellness Center on the west side of Sioux Falls on West 32nd Street for $9 million. This effort represents a big step towards expanding indoor recreation opportunities in our community, especially on the western side of Sioux Falls. Really, really big opportunity for the western side of the community. Kids and families is a topic that we talk about a lot and an initiative that's very important to my administration. Obviously, a big win for kids and families that we will be able to provide more year-round indoor recreation activity to the entire community, but again, a really big boon for the west side of Sioux Falls. When we started talking about this, Sanford and the city obviously share the same vision of a commitment to healthier and thriving communities. So that's why they've been in that wellness center business for so many years. And this acquisition allows each of us to leverage our individual strengths, us providing community-based programming, recreation programming, and Sanford to continue to focus on its core mission of delivering world-class health care to a very large part of the upper Midwest. We're grateful, really grateful to Sanford for working with the city to make this acquisition possible as part of our upcoming Aquatics Bond that we're going to be bringing forward here in the next couple weeks. When we met with Sanford on this, one of the discussions that we had was talking also about what's happening with the Riverline Center, and we're going to talk about the connection here on that in a minute. But I want to show a slide right now, and I think that slide can come. Oh, there we go. When we had our initial Riverline District announcement several months ago now, you see over on the left where it says current, that blue line, and again, I'm colorblind, I hope it's not purple, I think it's blue, represents the current level of indoor recreation, public indoor recreation space that we have as a community. You'll see that with this acquisition, it will move us closer to what's a target level of service, and that target level of service is National Parks and Rec Association recommendations for communities. So we're obviously well below that. The West Side Recreation Center will help make a nice dent in bringing us closer to where I feel we need to be as a community. What we're going to be proposing as part of our Aquatics and Recreation Bond with the Frank Olson Recreation Center will help get us even closer to that goal. And then if this community continues to think bold and can get behind what we want to do at the Riverline District and repurpose our convention center, you can see where we could be in just 6 years. So we know we've had some catch up to do in this space. We know Rome wasn't built in a day and it's going to take some time. But with 3 opportunities right in front of us, this is a really, really big opportunity for kids and families in this community. This acquisition, specifically of the Sanford Wellness Center, it would add more than 70,000 square feet of indoor recreation space to the community. So for context, if you're wondering, well, 70,000, is that a lot? Like, give me a similar facility. Our Midco Aquatic Center is about 60,000 square feet. So if you've been in there, you walk through there, you see the big lap pool and the rest of that facility, the meeting rooms, the party rooms, all that. That's about a 60,000 square foot facility. So we're adding a pretty large facility to the city's portfolio here. So with the repurposing of all these things in front of us, the hope would be to get close to that 250,000 square foot mark by 2030. Now that target level of service is going to continue to climb too as our population grows as well. So I'm going to have some other folks that are going to talk about this today, and one of those is going to be Steve Young, who I'm going to introduce in a minute. But Steve played a really big role in this, so I want to thank Steve and the leadership team at Sanford for working through this opportunity with us. Steve's the president of Sanford Sports. When we originally started talking about this, We had an appraisal done of that building. We looked at the space. We had some engineers go through it. We had our facilities teams go through it like you would any big capital investment that you're going to acquire. And at the end of that, appraisal came back a little north of $15 million for that facility and for that building. We, knowing that that would be a substantial lift for the city, came to an agreement for a $9 million purchase price with Sanford. So about a little north of $6 million discount on what the appraisal was on that building. And I want to make sure that that is not quickly glossed over because of course, there's not a ton of buyers for a facility like that. We're obviously a very logical buyer, but we also realize that Sanford is making a significant discount in order to provide that facility to this community and to allow us to continue to keep programming it in the way it has been programmed, but also in a lot of new ways that we can do with our Parks and Recreation system. So when we did meet about this initiative, we did spend time talking about the Riverline District. And leadership at Sanford said, hey, we're very supportive of what we want to do with the river line, the repurposing of the convention center, what we want to build downtown, which is why we're willing to discount this thing, because the additional dollars that could have been spent towards, the city could have spent towards acquiring this, we'd like to use that as a token of support towards what's going on with the river line in that project. So that allows us to have $6 million less of debt service had we bought it at a full appraisal price, which we'll be able to pay for it, hopefully with future investments that we need to make for the Riverline vision. So one final thing I'll say is that we don't know what it will be called. Is this the City Wellness Center? Is it West Side Wellness? Is it what we are a community that loves to philanthropically support initiatives. There's naming opportunities for places like this. Not only inside, but also a title sponsor, a title naming right for this facility. So anybody out there who wants to sit down with the city and talk about how you can be part of this, as well as some of the other future aquatics and recreation things we're going to be bringing forward in the next couple weeks, we welcome that conversation. So I'm going to have Steve Young is going to speak next. We're also going to have Don Kearney with the Parks and Recreation Department is going to speak, and then Kurt Sale, City Councilor, is going to also talk about how the council's been involved in this and what this means for the city from his perspective. So I'll start with Steve, who is the president of Sanford Sports. Steve?
Well, thank you, Mayor. Thank you all for being here as well. I'd like to start off by thanking Mayor TenHaken, the City of Sioux Falls, the City Council, and the Parks and Rec teams, not only for their efforts to make this announcement possible, but for their continued vision of creating a healthier and more active community for this area. We feel strongly that this is a great opportunity for Sanford Health, the city, and the communities we both serve, and we're glad to partner in the way we have, as Mayor Paul has laid out. Our common goal is to do what we can to keep these communities we serve healthy and thriving. The wellness environment in the Sioux Falls area has evolved immensely over the last couple decades. As we were looking to right-size our wellness offerings and focus on what we do best, which is caring for people, we felt this partnership with the city made perfect sense. The city is gaining that much-needed indoor recreation space to program. I know it's just a start, but they're gaining that space, and then we're able to shift our energy into one location at our Oxbow facility. At this time, there will be no changes to the employees, to the membership at our TLS facility for at least the next 6 to 7 months as we work through this. And there will be no changes operationally at either facility for the next 6 to 7 months as well. Pending the approval, the City of Sioux Falls will acquire the TLS facility in late 2024, no later than January 1, 2025. And under that city ownership and operations, it'll continue to function, as the mayor indicated, as an indoor health, indoor wellness, and an indoor recreational space. Sanford Health will retain our leased space for our physical therapy services at TLS, and we'll continue to operate that for our medical services on that side of town. One thing I do want to make clear, we are not making any changes to the Oxbow facility. We will continue to own and operate the Oxbow Wellness Center, which is currently undergoing some renovations and changes in multiple areas of its own as well. And we will continue to invest in the medical and wellness services and programs at that facility. Now, to get a little bit more on the overall big picture of this, I'll bring up Director of Parks and Recreation Department, Don Kearney.
Well, thank you, Steve. As you can imagine, our team is extremely excited about this project and what it means for our community. Again, as Paul mentioned, we're grateful to Sanford Health for working with us to make this acquisition possible as part of the Aquatics Bond, which focuses on investing in the future of pools that need to be replaced and responding to the need for more indoor recreation facilities. From my perspective, this is a home run for us on many fronts. For starters, and probably most importantly, when we survey our residents, they tell us their top 5 priorities for parks and recreation facilities are indoor running and walking tracks, indoor exercise and fitness facilities, indoor playgrounds, along with trails and natural areas. It also moves the needle on providing year-round indoor recreation space and gives kids, families, and people of all ages something to do in any season. Finally, this facility includes indoor aquatics, court sports, fitness activities, indoor running and walking tracks, a variety of recreational programs and classes, and community gathering spaces. All of these align with what the community has been telling us for several years. We're excited about what this means for the future and the value the purchase brings to the city of Sioux Falls. In the coming months, we'll develop staffing and operational plans along with some new recreation services that we're imagining with our recreation team. With that, I'd like to turn it over to Councilor Kurt Sale to provide his thoughts about this opportunity. Kurt.
Thanks for everybody coming. First off, I'd like to shout out to my fellow city councilors because we've been working on and off on this thing for over 4 years to get it there. The amount of meetings that have been put together, the help that has come from the mayor's office, the Parks and Recs and Finance has been overwhelming to get it to this point. If you know the city, structure of the city, the one thing city council gets to do is spend the money. So we still have a couple of votes to take to spend this money, and that'll be coming up before this council is gone and the new ones are sworn in next month. So, you know, since 2022, there have been thousands of public comments have gathered to determine the updates and what our parks and our community need, and the future population and the growth of Sioux Falls and how it's going to be. There's been over 20 public meetings as part of the Aquatics Bonds, and our community engagement has found that reinforced the desire for additional indoor recreation space. Parks and Recs has done a great job identifying all of this. Their job for this growing community is immense, and we look forward to their stewardship in this facility. The Sanford Wellness works really great in the city's plan, and what I see is needed on the west side of the interstate for that indoor pool. So thank you, Steve, and your team for making this happen. And it's a great cost savings to the city overall. For when you see the bonds come out and the price of what an indoor pool is, this is really a discount for us. So it really makes a no-brainer for me to vote for this as we go forward. I know that there's still information flowing back and forth. My email inbox has been full when it comes to the pools for over the last years. So Don, why don't you come up and close this?
Thanks, Kurt. So as we look ahead to next steps, this proposed purchase, as we've mentioned, will be included in the Aquatics Bond as proposed, along with those replacement facilities for Keene Park and Frank Olson. Just a shout out regarding our meetings next week. We're going to be having our final open houses at the Keene Park and Frank Olson neighborhoods. Keene Park's open house will be at 5:30 on April 24th at Memorial Middle School, and Frank Olson's open house will be at 5:30 on April 25th at Cleveland Elementary. Following these meetings, the next steps for the Aquatics Bond include the Parks and Recreation Board's recommendation scheduled for April 29th, the Council Informational on April 30th, and then the City Council will consider the Aquatics Bond ordinance on May 7th and May 14th. So with that, thank you for coming, and our team of folks here today, we're glad to answer any questions.
Thanks. Can you clarify, this isn't changing the plans at Keene or Frank Olson? It's still outdoor aquatics at Keene Park and then an indoor facility at Frank Olson? That's still the plan?
Yep. Our plans for both of those facilities remain unchanged. That's a good question, an important thing to convey, is that our plan for Keene Park remains the same regardless of our plans of purchasing the Wellness Center, because we've worked for several months with the neighborhoods, and we're sticking to those plans, both at Keene and Frank.
And you mentioned staffing. Obviously, the new center at Frank Olson would include that too. Do you guys have this kind of positioning, with experience with the city, or how are you looking at staffing these indoor facilities?
Well, we have a good roadmap that we have with the Midco Aquatics Center, where we staff that and operate that very similar. The difference is that this is going to be more multi-purpose and a little more multi-generational with a variety of activities, but it's still indoor space. But it'll be open just like the Midco is from, essentially 5:30 in the morning till, evening hours, 10 or 15, 16 hours a day, 7 days a week. And so we've got a roadmap with regard to that, but it's just a little different twist. But yeah, we will be staffing up and working on our operational plans over the course of that 6 to 7 months that Steve had mentioned.
Can you mentioned the $9 million for the building purchase. Can you break down some of the specific numbers for the rest of the aquatics bond? What's the grand total, and where do Keene Park, Frank Olson, what's the breakdown there financially?
Sure. So we have are projecting $47 million for the Frank Olson Recreation Center. We're projecting $18 million for the Keene Park Aquatic Center. We're projecting the $9 million purchase for the West Side Wellness Center. And then we also have allocated an additional $3 million for kind of day one improvements to the West Side Wellness Center in addition to the $9 million. So we're anticipating up to $77 million for a total bond based a lot of various different factors on rates and things like that, and the time they sell the bonds can affect the final dollar amount.
What will the $3 million be spent on? What needs to be done there?
Yep, so we, as Paul mentioned, we've hired our consultant team to come in and review the condition of the building, want to know what we're buying. And so there's 2 or 3 main things that would be focusing on. Roofing of the existing building. It's in that 20-year time frame, so it's time for re-roofing of the building itself. There's some parking lot work that probably just potentially a full mill and overlay of the entire parking lot, which is a big part of that expense. And then there's some other interior, what I'll call cosmetic improvements, paint, carpet, signage, those kinds of things that would be included in that $3 million. But those are the major items.
What would it cost to build that new?
Yeah, it's a great question. And it speaks to the value that we're getting with the purchase price that Sanford has offered this to us for. Frank Olson is about 80,000 square feet at $47 million. And so something a little less than the $47 million, say $40 million, and compared to 9, it's a great value that we're getting, great square footage. Granted, it's 20 years old, but in our assessment of the building, Sanford Health has done a great job with their facilities team of maintaining it. But there are some things that we need to do to kind of walk into the facility day one.
Steve, this facility was not built by Sanford. It was built as a Y that ultimately didn't pencil out for the Y for various reasons, and Sanford stepped in. Do you feel like this is sort of the natural fulfillment of that? Like you took it over and now you're able to pass it on, sort of, it was not ever your building to begin with.
Yeah, but we've also owned and operated it as if it was. We have a strong, committed team and a strong, committed membership that we would consider family. So these decisions, Pat, were not done lightly. These are intentional decisions and conversations with the city. And at this time, you're right. Yeah, it started out as a Y Family Wellness project, and we've been owning and operating it for quite some time. And now it's time to get back to that recreational need for the city of Sioux Falls. So it's a good time for us as well.
Do you have a rough idea of how many visitors this facility on West 32nd Street might receive annually?
Don't know those off the exact top of mind. I believe we have about 8,000 membership units between both locations at this time. So that one is a very busy facility. It's a great neighborhood, a very active neighborhood, and it's used quite a bit.
And the second question then, so the upcoming votes on May 7th and 8th, these are all three back together, right? They're not, as of right now, it's all or nothing on all three, correct?
Yeah, they're being presented as a package as a part of the overall bond.
I just had a timeline question on that slide. It had the potential convention center as at sort of repurposes indoor rec by 2030. Is that a realistic timeline given sort of the 2050 vision and where the Riverline District is at?
I think it's real. I think it's realistic. That's 6 years away, but don't treat it as gospel. I guess we put it on a screen, so you're going to document it. But there's a lot of work to do on the Riverline vision before we're comfortable sharing timelines. But goal without a plan is just a wish. So we have to at least start dealing with some sort of dates to work backwards from. So I think 2030 could be very realistic, if not sooner even, to have the convention center converted and potentially a downtown convention center built.
Don, how many employees does it take to staff current offerings that the Parks Department has? And then once this has all come to fruition, how will those staffing levels be changed?
Yeah, right now we have about 80 full-time employees, and it ranges anywhere from 200 part-time employees up to 800 part-time individual bodies, realizing that some work 10 hours a week, some work 40 hours a week. They're seasonal, obviously, as well. But there will be several full-time staff members, but also a significant complement of the workforce at both of these buildings will be like fitness instructors and people providing the orientation on fitness equipment, helping people with various programs and activities that we'd offer. And I will say that we're probably going to lean more towards recreational and a little less fitness focus with these facilities, because we want to have it for something for seniors and something for toddlers and things during the day that seniors and moms that don't have kids, their kids aren't quite in school yet, that need something to do. And so, but yeah, I could see several full-time employees as well as multiple seasonal employees, kind of like what it is now. We have I would say about 10 part-time employees per full-time employees because of the seasonal nature of what we currently do. And it works well. It's cost efficient to use our seasonal employees, and it helps the workforce in Sioux Falls as well.
But you will have to up staffing a bit.
Oh, absolutely.
Yeah.
Yep.
Can I ask about operating costs? The Midco is running somewhere around $1 million a year in operational. Have you looked at the operational costs of this whole package now and what that might be in the long term? I'm sure you have to balance out like the revenue and the cost of memberships. And will that be one membership across the board? Because that would seem to be a big a variable in the operational costs. Have you sketched that out yet?
Yeah, we've looked at that. We're aware of, with the existing facility, what the current operational costs are. Sanford shared some of that information with us. But we'll be looking at pro formas to determine, what kind of cost recovery we want to try to achieve. Obviously, we'll need to work with the park board, the city council closely on establishing a rate structure, which will drive the ultimate cost recovery on it. And so, for example, Wellness Center in Watertown is actually, brings in revenue in excess of their expenses. And so they've just chosen to say, hey, we're not going to provide subsidy on this facility. And they're able to achieve that. But it all really comes down to what your community values. We've got a strong history of providing free and reduced passes at our pools and being very helpful to those that are disadvantaged financially. And so I would imagine there'll be a program that will accommodate folks because we want this to be an inclusive facility. Paul, anything else to say?
Yeah, I think that's a very important point, that accessibility to the entire community is going to be very important with these aquatics initiatives, so that they're not just pay-to-play facilities. Now, we do have to have some level of cost recovery. I mean, we have to pay debt service and we have to operate them and so forth, but the difference between Sanford running this and us running this, and I'm not saying we're not trying to make money, but they're trying to run a business, an organization. We are trying to serve the community. And not that they're not trying to serve the community, but our focus is programming, making sure every kid in this community can have access to a place like this. And so we have pro formas that we've looked at on different models, both with Frank. Midco's a great example where the cost to access that facility is very, very low. That's why we subsidize it. If we were running it like a business, we'd jack up fees to cover that $1.2 million every year. So I know that's very important to the city council as well. Several of our councilors have brought up the fact that they want to make sure these things are accessible to the community. Because you may ask, well, there's 8,000-ish members between their two, and they use that facility, and now the city buys it. What's the gain of the community? Those people just keep going there, and now they're paying less. And so, well, now we've opened up the facility to a new tier of people who maybe couldn't otherwise have used it, and we'll be serving them in a different way with also the programming that we're providing, like Don talked about. Not so much fitness, but recreation, kids, families, things for everyone to do, seniors, so.
I wanted to ask about membership and tying that in with other city assets. I know we were here talking about golf memberships going through. Do you see kind of that, if you're getting in kind of this recreation model, would you tie that with golf passes or maybe zoo or pavilion, or has that been discussed at all or looked at, or is it just early stages still?
Over the years, we have talked to the Washington Pavilion, the golf courses, the zoo, the various different city facilities that we've got about potentially having some kind of shared discount program, and it's unfortunately a little more complicated in order to try to pull all that stuff off, and how does it really work? And but you know, I think we've got 6 or 7 months of runway here where we're going to have to work to put all those kinds of things together, answer those kinds of questions about, you know, multi-facility discount kind of things. That is what I think you're referring to. And so, again, to Paul's point and what I said earlier is that want to make it accessible, but it has to be balanced with cost recovery as well, so that you know, we make sure that we can continue to do all the other things that are priorities of the city.
Any other questions? All right, well, thanks for coming out. I'm sure these guys are available for a one-on-one if anybody would like it. So thank you very much. Have a good rest of your day. See you at the State of City tomorrow, 8:30 a.m. at the Convention Center.